Welcome to Beneficial Conversations, where we will explore the world of employee benefits and dive into the trends, challenges, and innovations shaping our industry. Join us as we sit down with industry leaders, HR professionals, policy experts, and thought leaders to discuss strategies for creating impactful benefit programs that support employees and drive organizational success. So whether you're an employee, a consultant, or you're simply curious, Beneficial Conversations looks to provide valuable insights, actionable advice, and inspiring stories to help you navigate the future of work.
Welcome to Beneficial Conversations. I am your host, CJ Jordan, and today I have the pleasure of being with Matt Ohrt. So let me get all this straight. We are the former VP of HR with Merrill Steel, the current executive director for the Free Market Medical Association, the current co-founder for Rise Up Health Plans, current author for the books Don't Feed the Beast, which is incredible. Go out and read it, as well as the children's book that you recently released this year, Good Care Feels Different. Did I get all that right?
You did. Somehow I find myself wearing a lot of hats. Although small clarification, it's not a children's book. It looks. It was what everyone says. So now I'm finding this humorous, but it's like a children's book, but it's not actually for children. It's for everyone. So yeah.
Yes, well, because the content in it is top notch. Children may not
Yeah,
necessarily grasp it, the design of it. Anyways, I digress.
yeah.
It's a great book, and people need to read it regardless. But I'm really excited to have you on the podcast today. I've been, obviously I've read the book, been a big fan of yours, kind of what you're doing, what you've done, and all that kind of stuff. So I know we've got a lot of different things to explore. However, my first question to all podcast guests is, I need to hear about your most memorable or your most favorite meal that you have had. Now, I know you travel around a lot, so it might be something that you've done, where you've gone and eaten different places. Maybe it's something that you've done at home with the kids and the family or something like that. But I just want to know about your favorite, most memorable meal you've had.
All right. Yeah, I think I've got an answer for that. I could answer that in many ways. Now but I've got a specific in mind. It's actually ironically mentioned in the book.
Okay.
And you might recall that. But I do like to eat. So I've been fasting actually. So I've been fasting, but I would even consider eating a gift of mine. I am gifted in that area that I'm especially good at it. But the one that I'll bring up is the Cracker Barrel discussion I had with the hospital executives. Now, I'm not sure what's happening with Cracker Barrel lately. I have no idea what that means or what that's about. So this is not related to that, but I do love their food and I love their environment. And it was kind of somewhat of a cold question meeting. I had a good relationship with the hospital, but it was I think it was three executives. And of course, I looked at it from a very simplistic, as I often look at life, farm boy view. But I said, the worst case, I've got a meal at Cracker Barrel. Like, what have I got to lose here, right? But I had a big question for them, and it was, would you consider bundling with us on some surgeries, even if it's just one? That was the question I posed to them, of course, and then it turned into a story that I think you probably recall and read about, maybe, but glad to cover that if you like. But I would say that's probably my most memorable meal, especially related to healthcare.
No, I love
Yeah.
it, and you can't go wrong. I mean, give me the biscuits with the gravy at Cracker Barrel, and I'm all in. Not to mention if you have like really pinnacle and just moments as far as what you're doing that are kind of transformational. That always
Mhm.
adds to it and makes it a little bit better.
Absolutely.
So tell me, I want to hear a little bit about kind of your background, how you got into the HR piece and then kind of where you've gone, since kind of getting out of the full-time HR role. Kind of give me a little bit of your background here and kind of how you got to where you are now.
Yeah. It's been a fun ride. I jokingly say, and seriously as well, but I find myself in a second career that was not expected. I did not see that coming. I've always been high energy. They probably would have drugged me up pretty well in school, or at least tried to if I were in grade school today. But I don't see it really as a fault as much as
Yeah.
that I just stay very active. I sit down, and so you'll see me wearing a lot of hats. It's not because I'm trying to impress anyone. That's one of the first things I say on stage as I travel around. not really interested in impressing you. I am interested in helping you and interested in
Yeah.
helping our country. I came across a quote actually by Annie Oakley recently, and she said, "For me, sitting still is harder than any kind of work." And that one just like stuck with me, right? So you'll get
Yeah.
a little bit of a flavor for who I am, but just so I come across, I guess the reason I say that is to come across the right way, that I'm not trying to outdo anyone or impress
Yep.
anyone, but it's just my temperament. But interestingly, I was always very entrepreneurial growing up. Had a baseball card business at 10, a construction business from 19 to 27 through school, and so forth and so on. But I found myself in industry for almost just short of 25 years, which I was always an interesting impact on industry, because they have trouble with change and they don't always like to change and so forth. And that was always me. So there was always that friendly friction. I was trying to help people. But I worked for Toyota motor manufacturing and had a lot of great experiences along the way, but really never delved into healthcare until the last 1/3 of that, where I took a job as the VP of HR with Merrill Steel,
Hmm.
just based on a question from the owners that, hey, we're already self-funded, but our spend is causing problems, right? There's two parts of a plan, the funding and the spending.
Yep.
And they're already self-funded, but they said our costs have been going up on a $5.5 million spend, approximately 10% a year. Hearing far worse this year for different companies. But they said, can you do anything about it? And that was actually an interesting spark to actually turn a topic of what we call internally with employers as benefits, right?
Yeah.
But specifically the healthcare was the part that's broken, to become passionate about a topic that I previously found quite boring. And
Well,
I
that's what I
talked
was going to ask. So you didn't really have like a big handle or, say or experience with that part. It was literally just kind of that conversation where it's like, hey, Matt, can you do anything about
that,
this?
that's it. It was simple as
Wow.
that, and that was 9 or 10 years ago. And I admit, as a kind of a long-term HR professional, right? I really didn't. I knew the game that insurance had handed us, and the simple parts of that, but I knew nothing more. And I think that's where a lot of HR folks are today, that they don't find it all that interesting. It's kind of bad news. Let's get through it and move on.
Yep.
But when I can solve problems, I learned root cause problem solving, because solving problems often means helping people. It became fun for me. So I developed this passion I didn't have.
Yeah.
And so it was hard work, and it's challenging, of course, but it became fun for me because I got in front of our employees. We had about 500 employees, about 1,000 members. And I said, as I just soaked up, I must have talked to 50 plus people. I said, I have a model in mind. It's not an easy one, but I have some
Yep.
ideas, and I want you to know that we're kind of in this car, and we're kind of driving toward a cliff, and we're not really pumping the brakes, and we're not really turning the wheel. So we know where that's going to get us. So, right, I've got to get them to let go a little bit. That's one of the nuggets of change. I've got to get them to let go, to take off their old dirty clothes before you can put on new clothes.
Yeah.
So I'm planting those seeds with them, but I said, I'm gonna lead us through, and we're gonna try some things, because we know what doing nothing does. But I'm also going to get in front of you every year. I'm not going to hide behind our broker, which has kind of been done in the past. The broker would
Yep.
just go through the plan details because nobody understood it, even the HR and so forth. But I'm just going to get in front of you, and I'm going to tell you how it went. And this is my plan, right? And so forth. And
Yeah.
so we took off on this journey that I didn't even know the details of, what year 2, 3, or 4 would look like. I really didn't know, but I said, we're going to start with DPC. We're going to start with direct primary care, and we're going to, in my head, we're going to evaluate after a year and
Yep.
see how it went, right? That's not a bad plan. Well, interestingly, we promoted it well, I think, and we even got requests. We started that DPC. The clinic was being remodeled, and I think it was done around January, but we started in something like November. We got requests to say, hey, this is like a free clinic. Can we see them now? And I said, well, let me check into that. So we found a conference room. And I was kind of careful here because, right, didn't want to come across as unprofessional, right? But it's like, I'm, giving all these cautions. We are building a nice clinic with all the facilities.
Yep.
However, if you'd like to see them in this conference room, they're there. and they filled up the schedule. And it's like they were just soaking this up. And then the CFO came to me. Now this would be about 5 months later. We had done the clinic or done the conference room, and then we actually opened the clinic and had the news and everything there. It was kind of fun and a big deal. But after the first quarter closed, the CFO came to me and said, Mathis, we had invested $250,000 in this full remodel, which sounds like a lot, but in healthcare dollars, not as much, right?
Right.
And he said it's already paid for itself. And so it was interesting, like from that time forward, I had not no approval, but I really had support and a green light to do step 2 and step 3 and step 4.
Yeah.
And so fast forward 5 years later, we had transformed our health plan. We had changed every partner to what I call trustworthy partners.
Yeah.
And we were saving about $1 million a year on our spend. Employees were saving 20% of that. And it unknowingly and kind of almost unintentionally sparked this movement in mostly rural central Wisconsin, one of the, not the high, by far the highest populated parts of a state that's not even that populated to begin with. So about 100,000 people.
So 2 kind of questions as you go through that. The first one is, when you were asked that question and you were going to tackle this project, I think for me, my natural inclination is to be like, oh, I've got this. I'm going to figure it out. No problem. Like, was there any, like, I always get the pronunciation of this word wrong, but it's the right one to use.
Mm-hmm.
Were you naive a little bit in your walking into it of being like, I've got this, I'm going to figure it out? Or like, what was your mindset when they asked you and you're like, yeah, I've got it? Like, what was your initial like approach to it?
I would say certainly naive and optimistic,
Right.
but certainly not going in with a head of steam or this level of confidence that, hey, I'm going to fix this.
Right.
Because I had several aha moments along the way. These are noted in the book, the vacuum purchase where I had to fill out all this paperwork for a $400 vacuum. Yet that morning I had signed with just an informal nod across the room from the CFO for the stop loss for $700,000. It's like, wow, I got to spend 2 hours on paperwork for a vacuum. But we're not viewing healthcare as a purchase, are we? We're viewing it as something else. It's not even through the purchasing department.
Right.
And lots of, aha moments like that. And that's every company. It's not on the radar. It's like this mysterious insurance, and it's just necessary and whatever. It's like degrading every year, and we get it. But these aha moments to say, this is actually our third biggest expense, not for HR, for the company.
Yeah.
And we dedicate like 45 minutes to it with employees once a year like that. Tell that to the CEO. How often do you think how much time and resources do you think we should dedicate, your third biggest business expense? I bet he's going to say, or she's going to say more than 45 minutes per year. So we start to just have a different view of this, and we start to view health, we say, well, okay, there's this mysterious insurance, but then we're actually just purchasing a service. We're just purchasing healthcare, are we not? Right. And so this doesn't have to be mysterious. Healthcare, as there's research, right, something like 27% of the dollars actually only make it to the caregiver. And we start realizing things like this, that where's all the rest of that money going that we just need to shop for value. And I'll close this little answer with this point, but this is, as we go around, I was talking with a company yesterday, and you can challenge me on this, or you can disagree with me on this, but I would say that companies already have this skill, and we as Americans already have this skill of shopping for value. We unconsciously evaluate quality, price, maybe accessibility, right? How soon can I get it? But we do this every day, and this is not a new skill it's just for some reason that skill's been blocked or shut off when we purchase healthcare.
No, I mean, I think you hit the nail on the head in your book, like when you go through the car buying experience and you parallel like buying a car with how we consume healthcare. And it's like, imagine buying a car in this scenario, and you go step by step through it, and it's wild. And I don't disagree at all. Like, I think we have the ability to do it. We do it in just about every other area of life, whether it's shopping for a refrigerator, a car, a new couch, whatever it might be. I think we absolutely have the capacity to do it. I think we've just been so the topic tends to be just so dull, and we continue to get hit over the head
Mhm.
with, oh, well, it's another increase. Oh, your premiums are going up. Oh, we're having to raise deductibles. And it's just this constant flow of negative information that it just, the benefits email comes out and you just archive it because you're like, I'm sure it's just another increase. And so
Right.
you
Right.
just lack the desire, I feel like, to do anything because you feel like you can't do anything. That's just at least so
Yeah.
I fall in line with kind of your thoughts on things. But our hope is that we try to change that narrative a little bit, one group at a time,
Mhm.
and, just help people see that there's a better way, and it doesn't have to continue to be this negative conversation. And it shouldn't just be one conversation, 45 minutes a year, and then never discussed again.
Yeah, it doesn't have to be, right? I mean, that's the and I use the word fun loosely. So if you know
Right.
me, be careful, right? And like fun, what are you talking about? But I think that
It's
notion of
benefits night.
it's fun. But the enrollment meetings, year one, year two, even, I got so much feedback, by the way. I'm like starting out on this adventure and everyone's like, oh, almost sarcastically, even, people would come in, oh, you're a mover and a shaker. I'm like almost, oh, you think you're going to fix healthcare? Go for it, Matt. But like everyone thought I would fail. And so we did. And so you kind of have to have this almost persistence,
Yeah.
and I don't know, where that it just comes from the heart. It comes from a passion. And I was like, I'm here anyway. I'm here anyway. So I could sit in the chair and I could accept it, or but I'm here. I could try to do something. But you start to realize these aha moments like, okay, what's the biggest deal? What do employees care about when they go in? They care about the premium. That's really mostly all they understand. That's what's eating their checkup before they even
Yep.
think about using healthcare. They haven't
Yep.
even needed healthcare yet. And so we think about, well, the industry has maybe just formed this in a way to say, what does my card cover? And that's fine, right? But they've taught the consumer, or they've led the consumer not to look at the total price. Well, that total price matters because this year's claims is next year's premium. And so even if we say, I don't really care what the total price is, I paid my whatever, my deductible, right? 3,000. I don't care if it was 100,000. I'm covered. No, you're not,
Yes.
because you go into the meeting the next year and you're like, what do you mean 30% increase? So Merrill Steel today, their premiums were 160 a month. This is in one of the highest cost states where things are out of
Yeah.
control, where normal baby deliveries are 30 plus thousand and so forth. 160 a month, 40 a month for single. They're still there today. They're still
Wow.
there today after this model. And that's not a promise to anyone, but it's really just a testimony to a model where we say if we control how we fund the plan wisely, but also how we spend for value, we find
Yes.
that we're getting better quality, where the cost is actually inversely related to quality in healthcare, ironically. And,
Yeah.
and so lots of details with that, as you know.
Well, and I was excited. Like, we had a renewal meeting with a group that we took self-funded last year, and they have kind of an insurance, review team that's comprised of members of different departments, different levels, and all that kind of stuff. And we were going through, and they've run really well over the past year, which has been great and very excited for them. But even one of the women in the meeting was like, I think this is the first time where we've actually started to see, she was talking to her specifically, but she was like, where we've started to see, based on like what we were showing in the presentations, how decisions impact renewals, like even as
Right.
self-funded, because you start to see that, hey, if I continue to be on this, maybe it's a specialty medication or brand name, when there's a generic alternative available, you know it it has an impact on the back end. Like, yes, you still have a copay and all that kind of stuff, but like that's not the full picture. The full picture is the plan's getting hit for a significantly larger amount than it needs to be. And
Hmm.
so when people get frustrated in some of these scenarios, we're like, well, why do our premiums continue to go up?
Right.
Well, some of it comes down to like the decisions that you're making. And like the more
Right.
that people can understand that, and again, some of it I feel like is on, brokers to work with HR and stuff like that to help educate and inform the employees, to create what I call, and what I've kind of read, a culture of health conscious consumers, to where people understand that, hey, my decisions ultimately have an impact on the renewal of next year, just like what you're talking about. Like, maybe I should go to this place that has a direct contract, or maybe I should go to these high quality doctors because the cost is going to be lower. Like, the more that I do the right thing, the more that I can keep more money in my pocket next year and stuff.
Right.
So it's, and she was like, we need to continue to get this message out to the other employees and really kind of work to draw that line between decisions that you make as far as how you consume healthcare and the actual impact on the renewal the next year. And I think like that's, if
Right.
more groups can continue to understand that, I feel like it's just kind of what the flywheel approach, like it just starts to build a little bit more momentum, and then people start to buy in. And then I feel like that's when you really start to see those positive effects down the line.
Yeah, it's especially when you start to gain momentum, it's fun, right? It took us about, in that case, 3 years to build
Right.
trust. And as you're talking about, right, if we follow the inertia, if we follow the status quo path, there really is no shopping mindset. They say, how do you pay less for healthcare? You actually have to pay less for healthcare and get better quality, by the way. Get better
Yeah.
quality, not worse. But if you follow the old school, premium, deductible, in-network, never know the price, if the plan design's never revised and there's not shopping for value introduced, maybe to direct care, right, independent surgery centers, etc., then the buyer's not even empowered. So I think there's that challenge of, you change the plan design and you say, if you go to this surgery center, maybe it's no deductible or however you structure it. Then of course there's another challenge. It's like, hey, you should do this. And they're like, no, I don't really want to do this. I like the old school. I like that big logo and that big building. And it's like, no, but this is free. And so I always say, let the plan design do the work for you. You don't have to push people or twist arms or talk people into anything. You just have to educate and say, you're currently buying a Chevy, but you're paying a Cadillac price. How about we buy a Cadillac and we'll get it at a fair price? We'll get the best quality. And so, right, all those things that go into it. But it can be so much fun once you start to succeed, if you're willing to try.
And so you said the first decision that you made was implementing the direct primary care. I'm sure a lot of research went into, what do I want my first step to be? Like, what do I need to do first? What led you to believing that DPC was the best first step, amongst a bunch of other options that are out there?
Yeah. And I'll be candid here, CJ. I didn't know anything like I know today. So, I mean, this was like, take the plane off. Oh yeah, we got to put the wing on it here. And, right. So it was a lot of that, but I mean, we know primary care is important, but I think the difference between, we recognize that hospital care, and ask a doctor, it's not their fault, by the way, how many patients they have in the hospital primary care. I've heard as many as 4,000. The average is 2,500 to 3,000, which means they're seeing 30 patients a day, which means they're getting an average of 7 minutes per patient, which means they're having rushed care, which means they're over referring and over prescribing, etc. Then we juxtapose this next to direct primary care, which can restore, as I heard Jay Kempton said, I'm not sure if he coined this, but we revolutionized back to 1955. And we say that you can have 30 or 60 minutes with your physician because that physician only has 500 patients. What he or she should have. And you can have time, and you can actually call them outside the appointment, and you can actually manage your diabetes or your weight management or your chronic condition. And it's not as simple as that sounds. That's 80% of the care, 20% of the cost. And then the second part is, we use direct primary care as the funnel, as the collector, just as the systems do, but they're using it primarily just to refer to expensive care where they make their money. We're using it to impact the patient flow and essentially avoid the high cost, and say, if you need specialty care, if you need imaging, surgery, etc., we have, then your DPC can hold your hand and get you, in many cases, no cost care, not to the plan, affordable care to the plan, no cost care to you. So you're looking at that patient flow thereafter as well.
And so for y'all, because I know some do and some don't, but were y'all even including children in that as well? So like, the entire family could go see them?
That's right. The whole family it was included. So, and we had, in this case, it was on site. Now it could be near site just the same. Most companies can't do on site. It's harder to finance. But yeah, the whole family can go unlimited primary care, which sounds, if you haven't heard that right, but unlimited primary care for the whole family. and actually true primary care, right? They have time for you.
Well, and I think that's like, you know, I feel like when, especially when it comes to the pediatrician side, that there's this belief that like, oh, we have this great relationship with, our pediatrician. And this is not like, I really do like our pediatrician, and this is not a knock on her or anything like that. But there's this belief that there's this mutual, relationship that you have with one another. And I've joked with my wife, I'm like, honey, if we saw our pediatrician out, she would not recognize us. Like, we recognize her because, we see her, but she's seeing so many people throughout the
Thousands.
day, throughout the
Yeah.
week, throughout the year, that it's not really a mutual like relationship that we have. But I feel like because of the churn and burn that happens because of the system and the structure. So again, it's not her specifically, but I feel like like the DPC model where you shrink the number of people that somebody's seeing, like it does create the true relationship where you have the ability to pick up the phone and call them directly or send a picture and say, hey, this mark on the arm, what do you think? Do we need to come in or something along those lines? Like, I feel like it does, as you mentioned, kind of it lends itself a little bit more to that 1950s, 1960s approach where they walk in with their little leather satchel. Hey, CJ, how are the kids? All that kind of stuff. And you sit down and talk with them. That's something that I've noticed as I've kind of talked with people about it and kind of gone through this, but I don't know if that's kind of what y'all experience as well.
Yeah. I mean, it sounds in one sense we're innovating, right? As we put the pieces together, as we put best practices together. But in another sense, we're really just going back to the simple relationship model that we used to have. And how important is that? How important is it to have access to your doctor? How important is it to have a true relationship where you said, right, they actually know your name. They don't maybe remember just from the visit last week because they have 3,000. And I always find it really ironic in the model today, right? The two most critical parts of a healthcare transaction, the physician and the patient, are the two that are losing. If you look at the physician's morale in the hospital, right? Now, if they break off and start their own practice, they're no longer losing. But the two most critical parts are frustrated and losing, and everyone else is kind of smiling and winning. And we need win-win situations, win-lose situations, or lose-lose in that case situations don't sustain. So if you're interested, right, and that's what the FMMA is about, win between buyer and seller, or anyone interested in actually finding a sustainable path, come join us in that movement.
Well, yeah, so let's talk about that because you brought it up. Like, tell us a little bit about the FMMA, what it stands for, what it does, what its mission is, because I do think that there's a ton of really good information out there, but maybe not as many people know what it is or what its mission is in the U.S.
Yeah, I mean, and it may sound almost oversimplified or so intuitive when you hear it, but of course we're not living it, right? So I'm going to say it. And so FMMA looks at the buyers and the sellers in a free market, in a healthy free market. The buyer is the patient, and in the case of commercial healthcare, which makes up the other half of healthcare, the non-government half. The employer's paying around 80%, the patient 20%. So we look at employee. That's the buyer. But so the buyer making sure that they're having alternatives and choice. When we shop for a car, we have lots of choice, don't we? We can drive down the road and go left or right, right? They're all over. If we shop for TVs, same thing. If we shop for restaurants, groceries, same thing. When we shop for healthcare, it's like you got to go to these small list of providers, and we don't tell you the price. And so I think we all know how in fact, even the goal of the game Monopoly. Now I'm probably showing my age. Kids might not even have played this game. But the goal of the game of Monopoly is what? To be the Monopoly king, right? To take over and control and drive everyone else into bankruptcy. And so with this network model that we have, we really have a monopoly, and we don't have alternatives. The network is really a guise for the monopoly. It's certainly not lower prices. So if you think you're getting a better deal because of their size and their negotiating power, you're not. I heard one transaction where it was an $81,000 81.5 surgery. The hospital got 40, and insurance got 40, and the doctor got 1,500. Does that sound like value? That's probably the norm, but does that sound like value? So then the question comes from the free market perspective, the FMMA. How do we interrupt? How do we stop a monopoly? How do we break a monopoly? And even the CFO I used to work with at Merrill Steel, he used to say, let's just meet with the hospital and let's reach their hearts. I don't want to sound cynical here, but I might, right? Let's reach their hearts. And they're just, they're nonprofit and they're community oriented and so forth. And they're just going to change everything because they realize that there's 3,000 people in just this county alone on being sued and they're garnishing their wages, and they're putting liens on their home, and they're just, their heart's going to melt. And I wish that were the case. And I never give up on that, by the way. If you're listening and you're a hospital, call me. I'll help you. But I don't think my phone's going to ring, unfortunately. I hope it does.
No,
But how do you break a
unfortunately not.
monopoly? Let's say there's one grocery store in town, right? And this is going to seem overly simple and intuitive, but if there's one and let's say the owner isn't all that concerned about the community, he kind of likes his money and so forth, and so the milk is now $18.99 a gallon, and the eggs are $100 a dozen, and we just go in and we're overpaying for groceries, and so we can go to the owner and plead with him and say, my family's going bankrupt here, and so forth, and see if we can reach his heart. I guess that's not an option to rule out. But what's really going to cause that owner to have a change of heart? And this is a story in the book about the Cracker Barrel, what happened afterward with that hospital. What happens if another grocery store opens in town, and another grocery store opens in town, and another, right? 1, 2, 3, 4. Now we have a healthy competition where a free market environment drives quality up and cost down. And it forces the seller to have a healthy sale. And if they don't, in a monopoly, you just smile and say, I'm sorry you had a bad experience. We'll see you next time.
Yep.
If you don't have a monopoly, then you say, oh, why? I'm losing all my customers to this store across town because they're just got a great offering. So what we're trying to create is this natural free market economy. And that's how we're going to break this. Probably not by pleading with them to care for their community, but by offering alternatives, by having buyers, by employers getting in the game, and then supporting the sellers and the direct care to start practices and have actually reasonable offerings. And so that's what the FMMA is about.
And so dovetailing that in, because again, creating options and giving people something different to do, giving them another grocery store to shop at, so to speak. Is that what you're, trying to accomplish with Rise Up, and kind of what you're helping groups understand as far as, hey, there's a better way to do things, and there's better places to go and better options and stuff like that?
Yeah, that's what we did regionally with Merrill Steel. Of course, we were just looking at our own situation. We just needed some within an hour. And then I co-founded Self Fund Health, which is this shopping model based on the same plan design I did at Merrill Steel. That's spreading across the Midwest. And so the movement transitioned to Wisconsin and now even other states. But we had 15 DPCs in Wisconsin in 2020. Today we have 140. And so the same for imaging and infusion and surgery. And then I go to Texas. I do what every wise person does. I leave a fast growing startup, and people ask me this, why did you leave? What happened? And well, because it's the country of Texas. Who wouldn't want to go to the country of Texas and start a health plan in the most independent culture ever? Right. And that's what we're doing with Rise Up. What's interesting is, I talked about Wisconsin was somewhat barren before we started. The doctors were frustrated. So the pump was primed, but we needed buyers and we needed direct sellers. If you go to Texas, it's like there already. I've counted, I haven't even really started counting. We're just focusing on a few cities. At least I have 150 DPCs. I bet there's maybe double that. And there's imaging, independent imaging everywhere. There's surgery centers, etc. So the point is, Texas is primed for this. We just need to kind of bring it together. And so are many other states. We can do this in any state, some easier than others. Yeah, it's just providing alternatives to the monopoly is really what we're doing.
And so essentially you're just taking the pieces that are in place and trying to bring them together for a group in a cohesive manner. Like, hey, we've got this DPC over here that we can use. We've got these imaging centers that we can use. And you're essentially just collecting all of these pieces together and putting the pieces in place so that employers, understand where to go, how to do it, and all that?
Making a plan design where not only are those higher value places to shop, not only are they there, but they're in network or no cost. Right now, they're
Yeah.
kind of out of network. If you look at the standard Buka plan, they're out of network. It's like, let's see, I could spend $100,000 on a hip replacement here. I could spend 17 here. The 17 is arguably a better surgery. Oh, I'm sorry you can't go there, CJ, because that's out of network. You need to go spend the 100. Yeah, but yeah, that's going to impact my premiums next year. Yeah, I'm sorry, but it's out of network. So you're going to have to stay in your network. Right? That makes no sense. And so
Yeah.
we make sure the sellers are available, but then we free up the buyers so they can manage those premiums. This year's claims, next year's premiums. If we don't manage our spend, this trend is gonna, I think it's getting worse. I think it's actually getting worse each year. And you
Yeah.
probably see that even more than I.
Well, and I just kind of had this thought as you were talking through this, and I'm not pretending that this is an original thought, but it literally just happened as we were talking. Like, obviously, the conversation, from HR to employees and stuff every year at renewal or, whatever, tends to strictly be on deductibles and coinsurance and out-of-pocket max and stuff like that. But does more information and communication need to happen around what the overall cost is on certain
Mm-hmm.
things at different places, like to help the employees start to understand, again, like this health conscious consumer mindset, because they're only worried about, oh, this is going to be $250, or maybe it's copay model, well, this is only going to come out of pocket $500 for me, like I'm fine, I don't care. And maybe it's still $500 regardless of the hospital that you go to, just based on your plan design. But obviously, what's going to hit the plan overall might change drastically just based on the different providers. So does more education need to happen to the actual employees? Like, do they need to see kind of behind the layers a little bit, or behind the curtain a little bit, to understand not every hospital is the same, not all prices are the same. Imaging here is 5,000, but it's 500 here. Like, I don't know that ever actually resonates with the employees. And so they get mad when, next year's renewal comes and they have a 10,
Right.
15, 20% increase, but they were probably unknowingly participating in that. And they're like, well, it was $500 for me. I didn't know that it was 3 times the cost as this hospital. Like, what are your thoughts? Like, is that something that y'all were doing,
Mm-hmm.
previously, or what can groups kind of do as far as that goes?
I think we need to use, right, get out of the box.
Mhm.
Like, get out of that box and start thinking, and talk about the things. We completely restructured our enrollment meetings. We need to talk about the things that matter.
Right.
Like, we know here's the mode, but we need to talk about the things that matter. It's like walking into a boat store. Um, there's different boat change, Cabela's and others. They sell boats, but I remember seeing a boat once, and it's like this really nice fishing boat. You like to fish? I like to fish a little bit. And the
I'm
boat.
incompetent when it comes to fishing.
Oh, okay. And you could take this to a car or anything, but this was just Bass Pro does this, which I love those stores. I think they're
Yeah.
overpriced. I think they're really high. But I used to travel to Missouri, and Springfield was the headquarters of that with Merrill Steel. But the boat was like something like $299, and I'm like, dang, that's a really nice boat for two. You know what? Maybe I should buy this boat. And then I look, and it's like, what's the financing? Oh, it's like 30 years, interest rates like 18%. Right? I need to look at the whole picture. And
Right.
that's kind of right. Healthcare, they say, is the only thing that we spend more each year and we get less. So we're talking about things like deductibles, premiums, etc. But are we ever talking about the root cause of healthcare, that we're overspending grossly for healthcare services? And that's always the hidden part. And I always say, even if you're in the camp, I'm personally in the free market camp, a capitalist
Yeah.
camp, and maybe some minor intervention, maybe some caps on prices or something. But it feels to me like when the government gets involved, like ACA,
Yeah.
um, the Affordable Care Act made healthcare prices explode because they
Yep.
incentivized insurance companies to raise premium. Okay, so thanks for that help. But right,
Do less.
but so just stay out of this for a little while, right?
Yeah.
But I believe the free market is a natural way And so when the free market dynamics kick in, things become healthy. But we've got to
Yeah.
start talking about in enrollment meetings what actually matters. And even if you're on the side of taxpayers paying for healthcare, right, the single payer as they call it, I would argue that nothing will ever be fixed until we stop overpaying for healthcare, because whether
Yep.
companies are paying for it, families or taxpayers, which is really all of us in the same people, we're going to go broke if we don't stop overpaying. So we need to stop talking less about the funding and more about the spending.
Yeah, I agree. Um, One other thing that I really wanted to jump into, because I feel like it's such an important topic, and it's something that I hear a lot from, my side of the table is, we're bringing different strategies into groups, and, you just see HR and CFO's face just go like slack, and you're like, no, 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 don't like, I don't want to lose you yet, but there's just this fear that change, is always going to be bad, and it's going to be terrible, and the burden is going to be significant. And there is a whole chapter in Don't Feed the Beast dedicated to change
Mhm.
management.
Mhm.
And I think that it's such a critical piece of the puzzle. Because that's a huge part. Like when you go from fully insured to self-funded, or when take some additional steps, and maybe it's reference-based pricing, or cash or direct contracts or something along those lines. It's people are consuming healthcare in a way that they haven't before, and so it's change, and there's probably going to be some friction and some heartburn. So, what was your approach? What did you learn? As far as change management, is what were the best practices, I guess, that you identified as far as leading change management when it comes to health insurance
Mhm.
programs with companies?
Mhm. Absolutely. Great question. And I think many avoid solutions. And that's why I go back to we're here anyway. So you can, like, how many years of career do you have left? Oh, 35. Okay. You want to deal with that for 35? Wouldn't it be more fun if you went through a little bit harder journey of 2 to 3 years and fixed that? So that's what's, I think, needs to be in the leader's head. Or what if we could fix this? What if? We can't really get worse anyway. Can we really mess it up that bad? I said that to someone once, and they're like, I'm like, why, what's the fear of change? And he's like, because it could get worse. I'm like, I don't know. It's pretty bad, right? Like, it could actually get worse. So I think there's,
Let's lay this trajectory out,
yeah,
comparing the route that you're on to this one that we could put in place. Yeah, it
yeah.
could get worse.
And that's the leadership, right? So that's the
Yeah.
leader. A person starts a movement alone. A person starts a transformational change in a company alone, and maybe they gain then the support from the leaders and so forth. You need top level support to go too far, because you're going to run in. What I've learned is I've changed attendance policies and reward systems and in more complex things the last 25 years, because whenever you fix something, you have to lead the large group through it.
Yep.
So it's been a part, and I've realized you can do everything right and it can still fail. Someone at a very high level can kick your legs out, can stop the change. So it's not everything is under control, but usually there's the bumps, and then the bumps smooth out. So the first is that transformational leader, we call it an internal champion, to have the passion and some vision.
Yeah.
And then when you're talking to the masses, the majority, and right, you want one by one to come join you. It's like Red Rover. You ever played that game, Red Rover?
Oh yeah.
And there's different rules I've learned, but our simple way was you had two lines of kids and you hold hands
Yep.
and you say, Red Rover, CJ, come over. CJ tries to ram through and break the hand. This is a really simple game. Break the hands. And then if he breaks the hands, he gets to take someone back to his team. If he doesn't, he has to stay with this team. The one with the most people at the end wins.
Yeah.
So transformational leadership's kind of like that. We're just trying to gain people. But first, what's often forgotten is, like, you and I could talk for once a week for a year, and man, we understand this problem, Toyota language, understand the problem well. Before you even start, you and I understand this problem upside down, left and right. And
Yep.
then we go get in front of the people and we act like they've been in those weekly conversations for a year, and we say, good news, friends, here we go. And they're like, what are you talking about? The last 3 changes you've led have failed, so I'm not following you, da da da. We need to be leaking that slowly and regularly, and we need them to beg us to change. before you even
Yeah.
start. We need the majority to say, can we please do something about this? You keep talking about, I get it, Matt, this is broke and I'm going broke and my family's going broke. Can you please change this? That's what we need them saying before you get in their face and say, I've got some great idea and I'm going to save the day. No, right? We're going to do this. So you need that buy-in. And from there, then it's just going through the, as I call it, the wilderness and the journey. And it's just never easy. You just have to know that. But I would just say it's always worth it. It's never easy, but always worth it. And there's lots of nuggets in the book about what I've learned over the last 25 years of how to do that well.
Yeah.
One of the things I call milestones, right? It's like, hey, we got this far. That's a big deal. We should celebrate that. We got this far. We got this far. But it's always been worth it for me. There have been times where it's been stalled because of a brand new CEO that took a different direction. It was just frustrating. Sure. But more than half of the times I've led those, they've succeeded greatly. And so that's been my passion.
And so are you trying to bring in pretty regularly other, it starts with one champion, right? But are you trying to bring in potentially other, maybe it's department leaders, or maybe it's just different people, who have some sway, maybe not from a title standpoint, but just from a level of respect standpoint? Are you trying to bring in some of them, not necessarily early on to make decisions on what you're going to do, but helping feed some of the information as far as what you're trying to accomplish through them so that they can continue to, let that flow throughout the company organically? Or what is that kind of, I know you said leak the information and stuff like that, but what does that process kind of look like? Is it organized, or is it more just kind of like water cooler talk and you're hoping that, maybe you throw some nugget out there and they kind of take it back to everybody?
I would say it's a bit of an art and a science, right? A science,
Sure.
as in that definition would be 100% predictable, do 1, 2, 3, 4, 5. And art is, oh, I've got to read this today. Oh, I probably need to do this today. This is not in the formula, but I've got to do this today. And so I say it's a combination. I'm certainly, any big change, you need owner and or, depending on your structure, CEO, president, board, whatever, some support there. Or when you run into the big bumps, you're going to get fried. They're going to be like, we need to go back. This isn't worth it. We need to go back. I always found that interesting too, as the Red Sea was parted. We talk about that, right? And then it closed and it engulfed the chariots of Pharaoh. And that's the part we remember. But one thing that hit me, when that Red Sea went back, guess what? They couldn't go back because they probably wanted to go back. So once you get to, right, if you know you're on the right path, let's not talk about going back. Let's talk about how we're gonna go forward. Then you also know who are the influence. And so I've worked mostly in manufacturing. It doesn't have to be. Who are the influencers, say, in a manufacturing plant? Maybe you got 500 people, maybe you got 50 people. It doesn't matter. The influencers who are vocal, who people follow, maybe they don't even have a supervisor title. It doesn't matter. Who do people follow? I'm going to go to them first, aren't I? If I hear a rumor out on the floor, or I want something leaked, maybe the wrong word. I don't want to sound like this is some kind of game, but right. If I want everyone, the grapevine, and everyone to hear about something, guess who I'm going to go tell first? Guess who I'm going to go talk with? I'm going to talk with this very vocal person who people trust and follow. And guess what? It'll be throughout the whole building by the end of the day. Right? If you don't, for lack of a better way to put it, play those games, you could be doing everything right and have a great vision and get your lunch eaten. So you have to be aware of at least those things, because people are people and people are messy, and that's hard to articulate, but that's real.
How often are you using, success stories as a way, to hopefully communicate with the employees that, like, hey, like, what we're doing is working, and here's an example of, like, do you find employees willing to, share their experience? It doesn't have to be in detail, obviously, but hey, I was on this medication, Matt and our PBM team was able to help me, go from this to this. It was a great experience. Like, are y'all regularly trying to communicate that with the employees to just affirm the choices, or just kind of reiterate what's possible and stuff like that?
I think people, right, because we're people and we need encouragement, right? We're not robots and we're not textbooks. And so I think those are a big deal. I think those stories, and they've got to be genuine and real, right? They can't be
Yes.
like, hey, get up and I want you to tell your story, but here's what you're going to say. No, no, no. Just tell. Are you willing to tell your? I think your story is really cool. Are you willing to share it? We find
Yeah.
that people start standing up in enrollment meetings. Once you get this going, where they got a free surgery and they couldn't afford it before, and it's caused them now they can play golf again or whatever, they start standing up in enrollment meetings. Sometimes they share too much, as maybe you've seen. It's like, oh, I got this hernia surgery, and like, no, don't show us, don't show us. We don't want to see it, but we love your story, and because you were
Yeah.
suffering before and you were broke before, and now you're neither. And so, but let those natural things happen, and maybe even facilitate them if you can. But I'll tell you, people can read fakeness right away. Never try to fake anything. Somehow we know. Somehow
Yeah.
we know whether something's genuine or fake. And so when you start seeing those genuine things pop up, and sometimes you're like, wow, that was cool. That was cool.
Mhm.
But that's fuel. That's like the gate, those video games where every so many seconds you have to go under those little gates. That's like that. It's like, oh, we got another 20 seconds going here. We got another 30 seconds. Keep this movement going. Because sometimes it is that fragile, especially at the start.
Yeah, I just feel like people get tired of hearing from, like maybe the C-suite on, hey, this is great, this is great, this is
Right.
great. And they just want to hear like the more relational, the more, Susie next door or whatever, hey, this does actually work. This isn't just a directive from, the C-suite down, but like this is a real thing. And I feel like it becomes more tangible as, you hear about your, desk neighbor or, somebody down the
Mhm.
hall who had a similar experience and something works. Like, I mean, again,
Right.
oh, I don't know if I can afford this. It's like, well, hey, like, look, we've got a solution in place. If you do what I did and, get in touch with this program, you can, access that, you can get your care that you need, and it's $0 because of what we put in place. Like, I feel like those are just the things that extend well beyond any, message that comes down from HR, CFO, or, VPs and whatnot.
Yeah, people don't really want to hear the corporate speak, right? I remember in one case we had, you just got to be real and genuine, and they'll sense that right away. And I always said, by the way, I'm on the same plan. Now, a lot of times you get these executives who make a lot more, so it's like they're not really that worried. They're like, "What's the big deal?" Yeah, this person over at $16 an hour, that is a third of their income. I saw that yesterday. It's a third of their income is the premium, and their deductibles $8,000. Yeah, that's a problem.
Yeah.
But we had someone, for instance, fall in the parking lot who was pregnant. And
Yikes.
so the first question, right? Are we salted properly? I hate salt because I'm a car guy and it eats your car. But are we salted properly? Is our parking lot safe? Let's take care of that first. Of course,
Right.
along with, and we had on-site clinic. Let's take care of the patient first. Let's make sure she's okay. Then prevent it from happening. Well, she went up to the clinic. She got it. They happened to have an ultrasound, and not only was she fine, thank God, and her baby was fine, but then I forget who asked her, me or the clinic or somebody said, and she was like, "Wow, what a blessing to have the clinic right here."
Yeah.
And somebody asked her, "Would you be willing to do a quick video on this? Just tell your story, right?" So again,
Yeah.
be careful. But
Right.
so she did. I think we even had it in a TV commercial. But it's like, so now you have a person walking around saying, someone's like, "I don't know about that clinic." Well, and she's like, "Let me tell you about that clinic.
Yeah.
My baby's okay, and then that baby was born, and that baby was fine, and bring the baby
Yeah.
in. Let's continue this story. But these are just the genuine things.
Right.
You can't plan that, and you shouldn't plan that, but take advantage of those things, and more will come along, right?
All right. So, last question to kind of wrap things up. What are you, because you've got an interesting kind of viewpoint on things. You've got the HR background, you've kind of got the consultant piece, and the FMMA side. What are you keeping an eye on as far as over the next couple of years? What's kind of top of mind for you?
I say a phrase once in a while. I say direct care is the future of American healthcare, and having been given this role in FMMA, I am very excited. It's one of 4 or 5 hats I'm wearing, but to support, probably even first and foremost, the buyers, educating, because I was one for almost 25 years,
Right.
educating the buyers to say, are you ready to do something about this? Aren't you getting tired of going in front of your people? And then second, of course, then the direct care comes alive, but create the demand. And I think right. I think the doctors, they've proved it in Wisconsin, they'll jump in and they'll create the supply of affordable health care. But the buyers got to get in this game. The employers got to become knowledgeable that their health plan is pretty crappy. I talked to an HR person yesterday. She said, I'm like very few, less and less people every year are on her health plan. Well, that's a sign. I'm on her health plan and I can't even really afford it. And I certainly can't afford to use it after I'm broke after the premium. And it's like,
Right.
okay, this is where we got to get out of that box and think a little bit. And let's just start talking real stuff, not deductibles, blah, blah, blah. Let's talk about, all the things that actually matter. Maybe those matter a little bit depending on how you structure, but often the stuff that actually matters is not being talked about. Until that happens, we can get what we're getting, right? This definition of insanity that we keep following.
Do you think that there will be, and I'm not talking monumental shift or anything along those lines, but do you anticipate or foresee maybe more groups being willing to move away from kind of the BUCA model because of what they see? Or again, I'm not talking like a massive shift, like some 30% all of a sudden are just gonna, shift away from that model. But in your opinion, like, do you think we're at a point where more groups are willing to evaluate the non-traditional model?
I think for advisors like yourself and for anyone who's passionate about this movement, I think getting out there and grabbing your megaphone and saying, are you frustrated yet? We actually have solutions, because there's two
Right.
parts to that. It's like, one, I've got 3 options for you this year and they're all really horrible. Which one would you like? Right? Like, we got to stop doing that. And then say, what are the actual solutions, and are they proven or are they experimental? But we've got to start right, doing something. How painful is this going to get for you? And so we'll see if the buyers are ready. I think they are. There's, HR folks, if you're listening out there, I was one of you for a long time. HR folks are labeled as transactional and afraid of change. There's your challenge if you don't like that, what I just said, right? Because HR folks lead the healthcare and the benefits. CFOs, CEOs, if you're experiencing this, you're going to probably have to prompt your HR person and say, let's go. This isn't really okay. It's our second or third biggest expense, by the way, that we're giving a glance at each year. I don't think right. This is an opportunity to save significant dollars and make your healthcare way better. So that's going to be a lot of my focus and the FMMA's focus in the next few years, to get that engine going and to get all advisors who tell these employers what's up and how things work to get in that game as well.
Yeah. Well, I love it, Matt. This was awesome. I really appreciate your time. I learned a lot just even in this, and I just really appreciate your words, your experience, kind of your passion for it, and just really grateful for the time today.
Yeah, thank you for what you're doing, and certainly reach out to me. I'm on LinkedIn, but anybody interested in the FMMA or joining this movement, we need you. This is a big deal for our country. So thank you.
That's right. All right, man. Well, have a great day. Enjoy the weekend that's coming up, and we'll be in touch.
You as well. Thank you.
Thanks, bud.